Good evening, everyone. A very warm welcome to each and every one of us joining today from around the globe. I am Saurav Kumar Gupta, and it is my absolute pleasure to be your moderator for this inaugural edition of Diabeticon 2025. Talking about Diabeticon, it is a 3-day international summit dedicated to exploring the crucial role of nutrition in diabetes care. This year's theme, that is Global Voices in Diabetes Nutrition, Innovation Meets Impact, aims to create a dynamic platform of global experts, thought leaders, and healthcare professionals to converge and discuss transformative approaches in diabetes prevention, management, and potential reversals. This summit is organized by none other than Navast Institute of Nutrition and Dietetics, a globally accredited organization committed to empowering the next generation of nutrition and dietetics professionals. NIND offers a robust portfolio of skill-based courses and is focused on serving the needs of students and healthcare professionals in this vital field. Over the next 3 days, we have 20 plus international speakers, insightful panel discussions, and opportunities for learning and connection. So I request everyone to engage, ask questions, and let's work together towards a healthier future. Thank you for joining us. Let the summit begin. So, before we proceed, it gives me great pleasure to introduce dietitian Neha Vij, the founder and chairperson of NIND. She have over 17 years of experience in the field of nutrition and dietetics. She holds a master's degree in food, nutrition, and dietetics and is currently pursuing her PhD in the same area. She is an IAO certified PCOS coach and specializing in women health disorders. She has done over 4 diplomas and 17 certifications in the field. Her dedication to empowering future nutritionists and transforming lives through holistic wellness and modern education has made her a leading figure in nutrition and dietetics. Please join me in welcoming dietitian Neha Vij to inaugurate the conference. Over to you, Neha.
Thank you so much. Thank you so much, Sora, for this great introduction. So today I'm a little nervous and as well as overwhelmed seeing my institution growing like this, reaching to a point where I can see and get inspired by so many students, professionals, and doctors and dietitians joining me in there on a journey, which was actually a vision for around 17 years ago. So looking back, when I just look back and I just कैसे बोलूं, it's very overwhelming. So when I just look back and I get to the point that I needed mentorship, I needed guidance when I was an intern. So at that point of time, I just promised myself that I'm going to build a community where interns, students, and nutrition professionals, they would not have to search for a community which would empower them, which would transform them, educate them, and make them into an individuals who can serve their nation. So now we have NIND with us, who has almost taught 8,000 plus students with different internationally and accredited global courses. And I just welcome all of you, and I would like to thank all of you in joining me in this journey. So Diabeticon, it is the first step which we are taken in, which it is the first summit which we are going for, and I am hoping for so many of summits to come. And I'm also hoping that all of you professionals and everybody would join hands with me to make this community a place where people don't have to look for education, people don't have to look for mentorship or guidance. They just name it and they have it. Thank you so much for joining in, everyone. It's a pleasure. Over to you, Saurabh.
Thank you so much, Neha. Your words were truly encouraging for us today. So, moving on, it is my distinct honor to introduce our esteemed chief guest for this evening. First, we have Dr. Hani. Dr. Hani is an accomplished consultant endocrinologist with over 35 years of dedicated service in Oman. His expertise spans diabetes care, endocrine disorders, and metabolic health. He combines extensive clinical experience and academic rigor evidenced by his MD, a prestigious diploma in diabetes, and numerous peer-reviewed publications. Please join me in warmly welcoming Dr. Hani. Dr. Hani, we would like you to address the audience with your words.
Thank you very much, ladies and gentlemen, esteemed guests. It's a great honor to stand before you today at this important conference dedicated to diabetes awareness, prevention and management nutrition. Diabetes is not just a medical condition, it's a global challenge affecting millions of people, individuals and families, healthcare provider, systems. Its impact is beyond physical health. It influences quality, economic stability, and public health policies. The conference serves as a crucial platform for medical professionals, researchers, maybe policymakers, industry leaders, to know and explore the latest advancement in diabetes care. Through keynote speeches, expert panel discussion, and interactive session, we aim to deepen our understanding and discuss treatment approaches and highlight preventive measures that can reduce its prevalence. We hope that this conference not only spreads the awareness, but also inspires us to do action, encourage us to collaborate together across the different sectors to improve the lives of those affected by diabetes. Together, through our knowledge, innovation, and commitment, we can make a lasting difference. And thank you for Sister Neha. Thank you for NIND for bringing me to this, important session. God bless you, and back to you, my brother.
Thank you. Thanks a lot.
Thank you so much, sir, for your insightful words. Moving on, I would like to introduce Dr. Mini Vora. Dr. Vora is a general surgeon with more than 38 years of extensive experience. She has served the Indian Army for a decade and currently working as a visiting consultant with Accord and SMS Hospital in Faridabad. Holding an MBBS and MS degree from SMS Medical College, Jaipur, Dr. Vora brings invaluable surgical expertise to our understanding of diabetes and overall health. Please join me in welcoming Dr. Mini Vora. Dr. Vora, I request you to kindly address the audience with your words. Over to you, ma'am.
Good evening, ladies and gentlemen and professionals. I would like I'd like to join this as giving the surgical experiences during diabetes, and I would like, because diabetes is upcoming as a number of patients are increasing daily in India. So I would like to thank everyone to allow me to come and join here. Thank you.
Thank you, ma'am, for sharing your insights with us today. Now, over to you, Ankita.
Yes. Hey, good evening, team. Welcome all to the summit. So, as we transition into an exciting part of our summit, a panel discussion, I would also all like to introduce our esteemed panelists who will be sharing their insights on various aspects of diabetes care. So, we already have met our chief guests, Dr. Hani and Dr. Minivora. Now, let me introduce the remaining panelists. We start with Dr. Sudeep Chaudhary. Good evening, Dr. Sudeep. So Dr. Sudeep is a pediatrician with extensive experience both in India and abroad. Currently, he's associated with Fortis Hospital, Gurgaon. He holds an MBBS degree of MRCPCH UK and an MBA from University of Manchester, UK. His passion lies in understanding how human nutrition affects metabolism and future health. Welcome once again, Dr. Sudeep. We
Hi,
next,
thank you.
yeah. So, Dr. Sudeep, I would just like you to say a few words, before we move on to our introduction of our next panelist.
Thank you, Ankita, and thank you, Neha, for calling me in. It's a pleasure to
It's our
speak
pleasure.
to you guys in IND and especially Neha. So, yeah, so I think it's a very important topic, and yeah, hopefully we have a great discussion. Over to you.
Surely, Dr. Sudeep. So, we next move on to Dr. Rajesh Jain. Welcome, Dr. Rajesh. So, Dr. Rajesh has been director of Jain Hospital and Research Center in Kanpur, India, and a former medical officer at the World Health Organization. He has led the Diabetes Prevention Control Project under the National Health Mission, supported by the World's Diabetes Foundation. With over 100 publications and numerous presentations at international forums, Dr. Jain is a prominent figure in diabetes research and education. He is also the editor-in-chief of Diabetes of Asia Journal and has authored the book Avatar, published by Penguin. His impactful work has earned him recognition, including appreciation from Mother Teresa for his contribution to the destitute. Welcome, Dr. Rajesh.
Thank you, Ankita. Thank you, Neha.
Dr. Rajesh, we would like you to speak for 1 or 2 minutes and experience your expertise and about the increasing diabetic cases in India and abroad.
Yeah, sure. Actually, as we already know, the IDF declared last year only that diabetes is pandemic. So it's gone from epidemic to pandemic. So it's a very serious problem around the globe, whether it is in the developing country or the developed country. So in fact, the developing country is affected more by this disease because they don't have resources to tackle this pandemic. So as India is concerned, if you see our work in National Health Mission, we started the gestational diabetes prevention program. And now this is included into the guideline of the government of India. And now every pregnant woman needs to be tested for diabetes. So my concern is that diabetes prevention should start right during the pregnancy, because that is the best time to intervene. And we can definitely make impactful in the whole country by screening during the pregnancy, and that prevention should go right at the beginning. So when the fetus is being programmed in the uterus. Thank you.
Rightly said, Dr. Rajesh. We all once again welcome you all. We move to our next agenda, which is the Q&A panel discussion, basically. So, Dr. Hani, Dr. Rajesh, Dr. Sudeep, and Dr. Mini, we have a lot of questions for you all, which our students have, passed on to us, and even our nutrition panel have, curated few questions for you all. So I would just pick up one name and I would ask you a questions, and we'll have more like a discussion kind of, a session basically now. So I think I would like to start with start with Dr. Mini. So Dr. Mini, the first question for you is what are the potential risks involved in case of poorly managed diabetes during pregnancy? Dr. Mini, you're on mute. You'll have to unmute yourself.
Sorry. Potential risks involved in poorly managed diabetes during pregnancy will affect the maternal and the fetal both. The maternal risks are there is increased risk of gestational diabetes, preeclampsia, hypertensive disorders in the mother, and because a pre-diabetic child is always a large baby, we may land into the cesarean sections, and there is post-surgical infections, and because of all these things, there is also increased perinatal mortality due to the combination of all these complications. In the fetal part, it is macrosomia, that is the large for gestational age infant. Preterm birth also is a higher risk in a neonatal, and with more of pulmonary, because there is a deficiency in pulmonary maturation because of the preterm. And there are high risks of congenital malformations, particularly of the neural tube, heart, kidney, and also there is neonatal hypoglycemia may be there, and all the electrolyte imbalances leading to hypokalemia are also there. And these preterm babies are prone to develop diabetes later on in their lifetime.
Thank you so much, Dr. Mini. The next question is for Dr. Honey. So, Dr. Honey, how does sleep apnea mobility exhibit the complications of diabetes, and how would you treat, or what treatment would you recommend to it?
Yeah, thank you very much for this important question. Actually, sleep apnea affect diabetes complications. Number one, because sleep apnea worsens the insulin resistance. It increases the insulin resistance. Why? Due to the intermittent hypoxia. There is a hypoxia in the body, and there is a sleep fragmentation. And this may trigger inflammatory response and hormonal imbalances. This is one. Number two, a poor sugar control. Frequent awakening and reduced deep sleep impact greatly the glucose metabolism. Number three, a high cardiovascular risk. We know very well that both conditions, diabetes and sleep apnea, may cause hypertension, increased cholesterol level, and high risk of heart disease and stroke. Not only that, but weight gain and metabolic syndrome. Sleep apnea disrupts the appetite regulating hormone, the ghrelin and the leptin. It increases the craving for unhealthy food, with further complication in the diabetes management. And lastly, the diabetic neuropathy is worsening. So sleep apnea can disaster a lot of things. Poor oxygenation, frequent arousal during sleep may worsen the nerve damage. And how to treat, recommended treatment, it's a little bit difficult. It's a challenging disease, but the main known treatment will continue to be main known treatment. Number one is the CPAP. So the CPAP, it's a continuous positive airway pressure, which may help the fellow to breathe well during sleep. And this, by the way, may improve insulin sensitivity. Number two, a weight management. And I say a big hand in weight management. Take care, because as even losing a small percentage of body weight will definitely improve sleep apnea. Thirdly, a lifestyle modification. Then nowadays there is, the oral appliances, mandibular advanced devices, we call it MAD. And then medication is to treat diabetes very well. Try to control diabetes. Don't agree with little. In our life in diabetes, maybe every day we see around 30 or 40 patients every day. We have to be very strict with our patients. I mean, the dilemma of doctors doing what the patient wants is to disaster the patient. You should do what the doctor wants, not what the patient wants. This is very important. And lastly, surgery. In severe case, we do something called UPPP, which is uvulopalatopharyngoplasty, which may help the hypoglossal nerve to be stimulated, and this may help a little bit sleep apnea to improve. Thank you.
That was very useful, Dr. Honey. So our next question is for Dr. Sudeep. So Dr. Sudeep, with the rising incident of type 2 diabetes in children specifically, how can we differentiate between genetic predisposition and a lifestyle-induced diabetes?
Thanks, Ankita. I think it's a very pertinent question because, as you know, that the incidence of type 2 diabetes in children is rising. Especially, there is a lot of interplay between the genetic factors and lifestyle factors here. And actually, it's very important for doctors or for people to differentiate between these two things. Is it genetic predisposition or is it lifestyle factor? So let's talk about genetics first. Let's talk about family history. So a strong family history of type 2 diabetes, especially first relatives, is always suggestive of a genetic predisposition. Many people think it's type 1, but no, type 2 has more of genetic predisposition than type 1. There are specific gene variants, and then children with genetic predisposition is more likely to get type 2 diabetes, even with moderate lifestyle risks. So that is very important, and this is proven. Now, if you talk about lifestyle and environmental factors, the biggest thing, which obviously is something to link with what you guys do, is obesity and poor diet. So high intake of processed food, sugary drinks, as near sedentary lifestyle, they all contribute. We all know this. It mainly does this by insulin resistance, so increase insulin resistance. Second thing is physical activity. These days we see children are glued to their smartphones or applications. They don't go out many times. For this reason, there's low activity level, which causes insulin resistance, mainly because there's increased fat deposition and decreased glucose uptake by the muscles. So two reasons maybe. And thirdly is important is what is the intrauterine environment when the baby was in the mother's tummy. If the mother was obese, if the mother had gestational diabetes, or if both had a low birth weight or a high birth weight, all of them influence the metabolic programming, which causes type 2 diabetes later on. Now, if we look at clinical presentations or metabolic markers, you will see that genetically driven type 2 diabetes will present at a younger age with a strong family history and with severe obesity. Second, if this lifestyle-related type 2 diabetes is more common in children with obesity, they will have something like cancerous nigricans, you can see that, and they will have metabolic markers. What are they? Like hypertension or dyslipidemia. If you measure the C-peptide insulin levels, it is very important because that will help us differentiate from type 1 diabetes. And if you want to do autoantibody testing, you can do this LAD and you can do this GAD65, IL-6, whatever. So I think this is motamoti what is important. Another important thing we want to talk to you about is response to change of lifestyle. So you have seen interestingly that if you change your lifestyle, go for a weight loss or lifestyle changes, primarily the lifestyle dependent component gets better and diabetes actually improves quite a bit. So that is very important that we know this. So I think I always tell this parents as a takeaway, the lifestyle remains a dominant modifiable risk factor, especially in type 2 diabetes. So focus on diet, exercise, and metabolic screening as part to prevent this entire onset. Yeah.
All right. So, Doctor, one question regarding to the same. So, how early can a child be, predisposed to this diabetic, or risk factor? I would say, like how early this age can be.
So it can be pretty early. So many children with type 2 diabetes, we have seen them developing by 8 or 9 years of age. So what we generally tend to do is in children who have metabolic component, who have a strong family history, we tend to do annual checkups. We tend to do some annual metabolic screens and try to pick up things early. Because we have seen early intervention always makes a difference. Because when children are early, the genetic programming is easier. If you give them lifestyle modifications, it's much more easier for them to do it rather than when you do it at a later age. So entire thing, they're like soft clay, you see. So when they're soft clay, you do the better things are ingrained in them. So I will say pretty early, from 7-8 years of age.
Thank you so much, Dr. Sudeep. So that reminds me of the next question, similar for Dr. Rajesh, that, so what are the psychological challenges when a patient experiences when attempting for this diabetes reversal, and how one can overcome it?
Yeah, actually, this word of diabetes reversal is common now. So 10 years before, we were not hearing this type of the thing that reversal is possible or not possible. So still there is a lot of confusion about the word itself. So first of all, let's see what is the pathogenesis of diabetes. So first of all, we have heard two names, impaired fasting glucose and impaired glucose tolerance. Okay. So before the diabetes is diagnosed, so we have a long period of 7, 8, or even 10 years of impaired fasting glucose or impaired glucose tolerance. So we call it the pre-diabetes. So as per the word of Renzo, Dr. D. Renzo, he's a big guy who discovered 3 medicine drugs, in fact, for diabetes control. So these are 2 different diseases. Okay, impaired fasting and impaired glucose tolerance. So what is impaired fasting glucose? So impaired fasting glucose is related to the liver actually. It is the insulin resistance in the first phase of the insulin secretion. Okay, so it signifies that there is going to be resistance in the liver rather than in the peripheral tissue. So we can demarcate it as a 2 type of the resistance. One is in the liver and other is the peripheral. So impaired glucose tolerance is basically a metabolic syndrome. That is the peripheral resistance. Okay. So HbA1c cannot differentiate between impaired fasting and impaired glucose tolerance. Okay. So we need to do this test in the fasting state, okay, and after 2 hours of the glucose load. So we need to differentiate between the two, okay, and 8 to 10 years, these things happens, okay. So it is very important to diagnose, first of all, pre-diabetes or at risk for diabetes, which can be done in the youth like 22 to 30 years. Okay, and the government program is basically is beyond the 30 years. So this is one of the lacuna in the National Health Mission, that they test it after 30 years. So first of all, we should improve our testing, okay, by the 20 years or by 22 years. Okay, this is the first thing. So once we do it, then reversal is possible. Okay, so it is better to reverse pre-diabetes early, because the chances of getting back to non-diabetic state is better during the pre-diabetes state. So, and most important factor during the reversal is that it is not 100% sometimes. Okay, so first 10%, 20%, 30% is reversed. So it is never 100%. So let's begin early, first of all. And there are various barriers, like you have to control your diet, especially the carbohydrate part, okay, processed food part, okay. And some of the guidelines is still not clear about the carbohydrate intake, okay, 30%, 40%, even 50%, okay. So here, the reversal part is very focused on the carbohydrate intake. So it should be as low as 20%. Okay, so you will see those people who are taking like chane ka dal, okay, as a grain. So you can make chapati of chane ka dal also. Okay, so pulses are better in reversing this pre-diabetes, in fact. Okay, and calorie intake is not important as far as reversal is concerned. It is the type of the diet which you take. Okay, and second part is the fat. What type of the fat needs to be taken? Again, there is a lot of confusion. Okay, so fat, what we are eating today is totally polyunsaturated fat. Okay, so and this polyunsaturated fat is basically a inflammatory fat, like palm oil, okay, even refined oils, okay, they are all inflammatory in nature. So we have forgotten our tradition of desi ghee, even butter. Okay, in fact, saturated fat is better than polysaturated fatty acid. Okay, so next part is the highly unsaturated fatty acid, like fish oil, okay, olive oil, and even coconut oil. Coconut oil is a completely a saturated fat, but very, very important in reversing the pre-diabetes and controlling the diabetes. So first of all, we have to, and we have to even take keto diet. Okay, keto diet has been criticized very, very much by the modern physicians. Okay, but I tell you, before 12,000 years before, human being was surviving on the keto diet. Okay, because agriculture took place around 1200 years before. So we had a lot of carbohydrate after that. And if you see 1980 data, then there was hardly 1 or 2% diabetic. Okay, so after 1980, the diabetes increased. So the main culprit is basically the carbohydrate. So we have to put lot of myth outside. Like sugar is being called the myth for diabetes. No, sugar is a risk factor for diabetes. So Sri Lanka is the only country in the world who put the sugar as a risk factor for pre-diabetes and diabetes in its guideline. And the other country failed to do it. So my point is that we need to be very, very basically with the research, we need to be very clear. Okay, we should not be under stress or under guidelines which is not tested. Okay, my second part is basically is because the diabetes is a chronic disease, so one has to live for a long time. So it's a slow process to reverse, and diabetes distress is very important because patient is suffering from the distress. So he need happiness, he need good sleep, good environment, okay, and healthy diet. Healthy diet, what I mean is basically the even the carbohydrate intake should be less. So more protein, as I just told you about the chana dal. Okay. And the fat, I already mentioned that we need to understand what type of fat we need to consume. Thank you.
This was really insightful, Dr. Rajesh. So we just want, as you said, that a lot of people don't know the definition of when do you call it as a reversal. So if you can quickly just summarize for us, when a client or a patient can cause that he's, the diabetes is reversed, because a lot of people think, okay, 2 months your reports are normal and they think the diabetes has reversed. So can you just quickly throw a light on the proper definition of when a patient is called as, okay, the diabetes is reversed?
Yeah, as I already mentioned, sometime what happened, if you want to reverse type 2 diabetes, we need to see the risk factor. So risk factor might be the weight. So patient will say that, okay, last for the 5 years, his weight has increased to 10 to 15 kg. Okay, so now we understand that weight is the cause of the diabetes basically. So if you reduce 5 kg, 7 kg in the beginning, then he is going on the reversal path. And this reversal should be for the long period of time, like 6 years, 1 year, 2 years, 3 years. Okay, it should not be for 2 months actually. So for 2 months or 3 months, again, he will become diabetic. Okay, so once he lose the 7 kg weight, but again, after 3 months, he gain 3 kg. Okay, for that way, reversal is not possible. So reversal should be long term, and he should be encouraged to strict on that diet. Okay, that is very important. I mean, monthly phone calls or counseling by nutritionists. Okay, and as far as I think we don't need doctors to control diabetes. Okay, we need nutritionists, we need physiotherapists, exercise person, sportsman. Okay, diabetes will never be controlled by doctors. Doctors are treating diabetes. Okay, they are not preventing. We are not preventing. I agree with that. Okay, so we need to have reversal program as already NHS has already reversal program in UK, and they are very successful. So 60 to 70% they are able to reverse after 3 years, 5 years, and this is going to be totally a clinical trial, completely double-blinded randomized trial, and they are very successful. My last thing is that some of the people are advocating low carbohydrate and high fat diet. Okay, then again, this is a problem. Okay, so you give low carbohydrate but high fat. Okay, and fat is inflammatory in nature. What type of the fat we are giving? Inflammatory fat we are giving, refined fat. Okay, refined oil. We say it is polyunsaturated. Okay, but polyunsaturated is not going to correct the condition. It is harming. It is inflammatory in nature. So we need to go toward highly unsaturated fatty acids, like we have what happened in the reduced trial. Okay, so we have various trials which shows that highly unsaturated omega-3 fatty acid is beneficial for the heart and for the diabetic patients. Yes.
Yes, thank you so much, Dr. Rajesh. So our next question is for Dr. Mini. Dr. Mini, how does diabetes impact surgical outcomes and wound healing?
This is a very important question, and we would like to maintain the blood glucose levels at a lower level in an elective surgery. But in an emergency, we can't do that. We have to go in for the surgery. And the impacts are, there is delayed wound healing, there is increased risk of the surgical site infections, peripheral neuropathy, and if the sugar level is not controlled, the infection can go deep rooted and may cause sepsis and even osteomyelitis, even if it is over the bone area. And lastly, it may cause the post-operative wound dehiscence, hematoma, and with all these things, we have to, the post-operative stay of the patient is also increased because of all these things. So we have to manage with higher level of antibiotics and control of sugar levels with maybe insulin inside the hospital. These are the major points.
Yeah, thank you, Dr. Mini. So our next question is for Dr. Honey. So Dr. Honey, can you explain the relationship between the autoimmune condition and diabetes, and also what could be the risk associated with these increased infections?
Actually, I feel that the questions are well prepared and really difficult. They are not easy questions. So I will answer this question. But before that, I want to add a very important note to the question of Dr. Rajesh. We are so interested as doctors and patients on how we can reverse diabetes. And I hope that this interest in reversing diabetes could be put more in treating diabetes. I mean, the patients are very, very well thinking of when shall I stop the medication? When shall I not be a diabetic? And I'm always telling them, think about when will I be well? When will I improve? When will I decrease complication? And if we all put our hands together in improving the lifestyle of these patients, we will not ask one day, where is the reversal? The reversal will come, definitely, today or after 10 years or after 20 years. But if you focus on reversal, get congratulations with all the complications that you have now. So this is for the question before. For this question, when you speak about the autoimmune, actually type 1 is an autoimmune disease, to tell you the truth, especially type 1. And together with that, we can see also the autoimmune thyroid disorder, and we call it Hashimoto. So diabetes, Hashimoto, and other like rheumatoid, lupus, celiac disease, all of these increase the risk of developing diabetes. Why? Because there is a shared genetic and immune system dysfunction, both of them. And how this will increase the diabetic risk, which is a very important question. Number one, we heard all the doctors speaking about the inflammation. And nowadays we speak about the inflammatory diet. So even food became inflammatory, okay? Not only, maybe life itself became inflammatory. Maybe friends became inflammatory. Maybe everybody is inflammatory. So when we speak about inflammatory, there is a chronic inflammation. Autoimmune disease causes a chronic inflammation. And this will disturb something called the insulin signaling on a deeper level. That's why diabetes is not controlled with this autoimmune. Number two, the genetic susceptibility. And this is a very tough topic. I'm not going into detail. We have an HLA-DQ, HLA-DR. Those who are preparing for their PhD, they know very well that autoimmune and diabetes are correlated together. Then number three, a cross-reactivity, not only genetic. The immune system may mistakenly, imagine, mistakenly hit the pancreatic cell as if they are enemy. And poor people, they start to develop this diabetes. They were not having it before. But because of the genetic susceptibility, the cross-reactivity, this happened. And before last, cytokine dysfunction. And cytokine, it elevates the TNF-alpha and the interleukin-6. That's why I told you this is a very tough question. It has full of input that are not easily to be digested. And there is an hormonal imbalance together. Autoimmune thyroid can affect the metabolism and increase the diabetic risk. So these are basically how they affect the diabetes risk. But people with both the autoimmune disease and diabetes are having some problems. One is weak immune response. And if this is dysregulated, there is a lot of infections. Number two, hyperglycemia may create an ideal environment for bacteria to grow. This is very important. Take care. That's why antibiotics are easily used in these issues. Three, immunosuppressive medication on their own, the biologics, they also fight infection and they have a cross-reactivity. Number four, there is a poor circulation and neuropathy. The diabetes-related complication like poor blood flow, nerve damage, and then increased risk of pneumonia. Those people are having very bad risk of pneumonia, UTI. You know, during COVID time, those people were easily jumping into the pneumonia and they were easily losing their life. We had seen a lot of these cases, poor guys who lost their life because of this weak immunity. How to improve this? One, and it will continue to be one, don't think about reverse. Think about blood sugar control. Like what Dr. Rajesh said, doctors are not reversing this diabetes, but are treating diabetes with all the other people. It's a team, but doctors start to treat. Number two, immune system support, balanced, non-inflammatory diet, rich in omega-3, antioxidant, and a lot of other issues. Three, hygienic practice, regular hand washing, and clean always. Then regular screening. Go and see. Whenever you have a symptom, go and see. Don't wait till it jumped to a non-reversing issue. Then lastly, exercise and stress reduction. This is what I have for your question. Sorry for being a little bit tough, but this is the answer of this question. Thank you.
No worries. It's so much of takeaway from all of you doctors, like, because even I think as nutritionists also, we don't deep dive sometimes, and, we just treat clients very superficially. So I think these insightful answers are really letting us learn and, deep dive into that's more just prescribing a diet, in fact. So our next question is for Dr. Sudeep. So Dr. Sudeep, what are some serious problems that children with diabetes might face, but they are often not noticed or not even aware about it, basically?
Thanks, Ankita. So I think good question. See, if you have a child with a complication, it means we as doctors have failed, right? So I think it's very important to understand that in having said that in children, diabetes is like an iceberg. The majority of the symptoms or the signs you probably can't see, they're deep embedded. Only 1/8 of it you can see. So obviously what comes through is basically, and interestingly, many children, the symptoms, even before symptoms happen, the complications start happening inside. So that also we have seen. So what we have decided, NHS does generally a once a year diabetic survey on every child. So they're given. In India, in clinical practice, we generally tend to examine the children every time they come into our clinics for routine examination. Because so if I go by system-wise, heart issues, we have seen that children may have high blood pressure, they may have cholesterol, or dyslipidemia. So generally, whenever we do blood tests, we generally order lipid functions, we do the blood pressures. They may have fatty liver disease, so a lot of them have something called as non-alcoholic fatty liver disease, NFLD. Again, this is due to fat buildup, obesity. Some of them have kidney problems because of macroalbuminuria, which happens pretty early. Again, what we do is we tend to do examination of the urine every 6 months to catch any microalbumin coming in. Diabetic eye screening is very important. So in NHS, we do it every year. In India, we do it every 6 months. Yeah, because generally in India, children don't tend to be very, very close to the diabetic range. They are a bit off. Nerve damages happen, peripheral neuropathy happens, so a lot of numbness, tingling, and pain. So there's always an examination module where we examine the feet of the child, tell them to take a few steps, observe their gait, take any early signs of numbness or gait change. Mental health issues are very important because teenagers generally have issues of depression, anxiety, maybe there's some cognitive issues, maybe due to long-term insulin use, constant checking of blood sugar. So a lot of mental health effect comes in, and I think the reason why we tend to patch them up with psychologists every year just to ensure that their mindset is fine. And obviously, bones and growth is a problem because we generally have seen that there are calcium deficiencies, and for that, there are weak bones and potential growth areas. So I'll probably say the 6 or 7 things, but I would highlight it's very important to examine children at every time when you see them. Once a year, diabetes screening is definitely important. Where you do blood tests at least 6 months in India, and obviously catch them before they manifest. Yes.
Thank you so much, Dr. Sudeep. One more question for you, Dr. Rajesh. So, What are your thoughts on the feasibility of diabetes reversal, and what are the steps which you feel that India should now start taking in terms of the even under the Fit India movement?
Yeah, that's very important question. And this is basically if you want to handle the whole population, because India is now crossed around 8 crore people are affected by diabetes, and almost same or more by pre-diabetes. So we need a population-based strategy which can be amplified through the government agriculture, machinery. Okay, if we see today the rice and the wheat, which is the principal diet of the country, and 80 crore people are receiving mainly the rice and the wheat, every person 5 kg per month. And if we see the data from the agriculture, then this breed of the wheat and the rice is 34% deficient in the micronutrients. Okay. And this is also the major cause of the diabetes. Okay, not only diabetes, obesity, non-communicable diseases. Okay, that has been very much ignored by the learned community of the country. So, so if we see this GM agriculture, genetically modified, the fruits you and me are eating, they're very sweet. Okay, so who put sugar into all those fruits these days? So so if you remember 40 years before, 50 years before, we have never seen such sweet fruits. So they are all GM, genetically modified. Okay, and they are deficient in antioxidant, they are deficient in micronutrients. Okay, so as Dr. Hani said, this food has become the inflammatory. Okay, so if you go to US or Europe, in US you will get only genetically modified fruits. Okay, so it's a very we have made this whole complex. Okay, like military complex. So this is food industrial complex. Okay, so a lot of refined processing unit of agriculture is responsible for the non-communicable diseases as a whole. Okay, so it's not only diabetes, it's so many things are going through the agriculture route. So this is one thing. Second thing is basically a very simple study which has been done in the England. So if you go in the morning, okay, in the crowded place, and they take your cortisol level, okay, and the same person, if goes to the forest in the evening, so the cortisol level decreases 5 times. Okay, so these are the stress hormones. Okay, so they are basically creating a cascade reaction in our body. They are giving information to the epigenome. Okay, that you have to now modify according to that. So urbanization, okay, more people, okay, different guidelines, okay, different people. So they are all creating a sense of stress, a sense of not any clarity in the system itself. Okay, so these stressors we call, okay, we call it hormone disruptors also nowadays. So now we already know that the genetics can be modified through the healthy epigenomic mechanism. Okay, like good lifestyle, good sleep, 7 hours sleep every day. Okay, that upgrade our 500 genes. Okay, so having a mindful meditation, yoga. Okay, so I think we have a completely clinical trial based on this preventive aspect of the medicine, that we can get lot of help through that. Okay, and avoid medication, because medication itself is the 8th cause of the death globally. Okay, so medication can lower the blood sugar, control the blood sugar, okay, but cannot cure it, cannot reverse it, never. Okay, we have a good drug, we have SGL2 inhibitor, we have GLP-1 agonist. Okay, they are good drug, definitely, but they are for the diabetes, though who already have diabetes. Okay, they cannot reverse this. They can 5 kg, 7 kg, 8 kg weight they can reduce. Okay, but the patient again gain it. Okay, it's even not long term. So we have to think critically that what can be sustainable in the country. So I think the government should put the preventive aspect more through the agriculture, exercises. Okay, exercise is very important. Now we have a data on the walking only. Is somebody who walks 200 step, 300 step, 400, 500. So all-cause mortality reduces. Okay, it's very simple data. Okay, number of step, okay, is equal to reduction in the all-cause mortality, irrespective of the disease. Okay, so all-cause mortality is a very, very important tool to know whether your or mine intervention is going to affect the whole population or not. So this is what the government should think. Okay, so we can see, as Dr. Hani told, we can see 40 patients, 50 patients a day. Okay, but we cannot do anything because people comes to us while they have diabetes. Okay, we can just control them. We can tell them, okay, you take your medication in the right time. Okay, so my point is that we should have a legislation. We should have a mechanism. We should have a system in our health and wellness center. Now this country has 150,000 health and wellness centers. Okay, again, they are promoting medications. Okay, so there is a less aspect of the preventive medications. Okay, we can reduce it by just doing all those testing. Okay, just 20 years onward, not 30 years. Because by the 30 years, things will be out of control. So we should just screening should happen to everyone while he reaches to the adulthood, 18 years or 19 years. And the female gender is key to the diabetes prevention. Why female gender? Because mitochondria, we get it from the female. So male and female both get their mitochondria from their mother, not from father. Because while zygote is formed, only the nucleus goes inside. The cytosol is taken from the mother. Okay. So once again, we should stress on our young girls. Okay. So if we stress on their physical activity, their healthy lifestyle, then we can achieve a generation which is free from diabetes. Because before 1980, okay, we don't have diabetes as a major problem. So it's the human-made problem, simply. Nature has not given us diabetes. It's already human. We ourselves has given it. And we can reverse this, definitely. Thank you.
That was really insightful, Dr. Rajesh. I mean, I'm sure the young generation, the young girls, I mean, Neha and Neha's Institute would really make sure that, we have upcoming a lot of good mothers and good wombs. All right. So, Doctor, with the interest of time, I would really like to keep it short. So, Dr. Mini, one question. So, there's a lot of buzz with a lot of millets also going on. So, if, either of us can, if you can just highlight about, there's so much of millet revolution going on. So, if you could just highlight quickly, each of you, if one line, what is your take in this millet revolution?
It's upcoming. And I think it will help the younger generation now.
But a lot of these younger generation are, I mean, they do not eat the normal food, healthy food also. But so how would you, I mean, how would, one would inculcate a little bit of millet-based diets into their meals? It's really challenging.
The younger generation, though they are into junk food, but they want to avoid the wheat. They are going into the other millets, as we have seen around. So
Correct.
it should help.
Yeah. Dr. Hani, Dr. Rajesh, Dr. Sudeep, if you can quickly just put little highlight on this, in terms of the millet revolution, which is on, and we could just wrap up the session.
Yeah, I think, okay, Dr. Sudeep, go ahead. I'll be after you, don't worry.
I'm sorry, I just went a bit offline. Can I just get it again?
Yeah. So Dr. Sudeep, I was just asking, like, since we, with the interest of time, we
Yes.
just wanted to understand that, what is your take on the entire millet revolution, which our PM has, initiated in India.
I think millet is a amazing food from the glycemic index point of view. Also, I think millet is great because it doesn't cause that much spikes. And if you go back to our history, Indians have been taking millets for ages, and we have been doing very good. So I think millet is extensively good thing and a very good thing actually to be done for people. I completely support it. I always tell my parents go for millets.
Okay, if I can add something to this issue, I will be having a session maybe on 23, and I will speak clearly about this issue. I was not knowing that you are preparing this question, but the answer will come into maybe 5 or 6 slides. But one of them is very important. I will say it now. Don't supersize. Don't supersize. And don't teach your children to supersize. And don't look into the TV and all the things that are supersizing life. The sandwich was 1 line, became 7 lines. Okay? The meat was 1, became 7. The fruits was 1, became 7, due to the genetic manipulation of things. So if you want to give an advice to the coming generation, you should give an advice to behave in a discipline. And before asking them to be disciplinized, we as doctors need to be disciplinized. When you have something, you can give that issue. If you don't have it, you cannot give it. So we need to know that diabetes, like Dr. Rajesh said, is made by us actually. If we behave well, if we eat well, if we sleep well, if we walk well, if we minimize our stress well, our lifestyle will improve and things will improve. Thank you.
Yes, millet is great, but I want to add one more thing. That the millet is still a cereal. It contains a lot of carbohydrate. Okay, the outer covering is good. It's full of vitamins, antioxidant, lot of things is there. Okay, for population, millet is great. But for the diabetes, I would prefer pulses like chane ka dal. Okay, because it can be used as a grain as chapati also. Okay, chana can be used in Punjab, you see. And what the ghoda kya khata hai chana for the power also. So we sometimes misunderstood that protein is not for the energy. No, protein is for energy also. Okay. So my take on is that because in UP we have done 57,000 pregnant women project for gestation diabetes, and we simply gave them chane ka roti, because to the rural ladies you cannot give complex diet chart and all that. So we simply said, cut your wheat, cut your rice, cut your sugar, okay, and just take chane ka roti. Okay, and we would be able to control 90% of the pregnant women, those who were diagnosed with gestational diabetes. And I think it's the largest study in the world where we have done in the Kanpur, 57,000 pregnant women. So we tested for OGTT and diagnosed gestational diabetes. So pulses should be the key, because as an Indian, we are sarcopenic. Okay, we have low muscle mass. Okay, so we are already protein deficient. So we should take protein, okay, in a very cheap form. It should be available to all, like dal, okay, chane ka atta, ankurit chana, okay, it's sattu. So I think this is very important in the Indian context. And second thing, with the dal, I would add that the oil part I've already discussed, that the coconut oil and desi ghee and the butter should be our main oil to be used. Thank you.
Thank you so much all. So thank you all of you once again for this engaging discussion. We will now move on to our presentations by our dietitian. So over to you, Neha, just to have 1 or 2 brief liner of introduction, and then we start with our presentations.
Sure. So now we have our dietitians panel where we have experienced dietitians who have more than 25 years of experience in the field. They are renowned certified diabetes educators, and they have different specializations in metabolic disorder, in PCOS as well, in weight loss and weight gain. So this is our dietitian panel who will be taking up for the next 3 days along with the doctors. So I would like to welcome all of you. Thank you so much for joining hands with me, making this community a better place to learn and to upgrade our skills and to move on. I'm so happy and so glad to listen from Dr. Rajesh and Dr. Hani and everybody that we dietitians play a very important role in reversing diabetes